over the last decade, there's basically been a five-fold increase in the numbers of students declaring a mental health problem to their institution, meaning that services that support students with long-term health conditions had seen a really significant increase in demand for their input. And so the PhD was trying to look at how the NHS and higher education could work more closely together. The findings have seemed to have had application at both a local and national level. So the findings have informed both UCL and the London Schools wellbeing strategy in terms of clarifying the role of higher education, their role in sort of identifying and how students can find appropriate support and navigate what's often quite a complex system.
Tom's contribution to Pentasouth in terms of helping us to think around issues of peer support. So Tom's been incredibly helpful in terms of helping us to think about how to set it up, and also in terms of helping us to think about how to make it part of sort of business as usual.
Also had some application at a national level. It's informed the content of the government's task force guidance on NHS and higher education collaboration. The NHR allowed me to do a full-time PhD that was contributing to a policy relevant question. It was able to facilitate connections to the government task force and also to universities within the local areas of the PhD took part, was conducted in the NIHR ARC, so the Applied Research Collaborations. And I had really good connections with several universities across the ARC region. And so I was able to easily to build relationships whilst I was doing the PhD. I was able to have input from members of the public and also students. Have not just supervisory support from the university, but from academics across the different areas of the NIHR. And I also was able to build sort of a really robust peer network, generally just enhance the quality of the research.